Module overview. The respiratory system is a vital organ system responsible for the exchange of gases, specifically the intake of oxygen and the elimination of carbon dioxide, to support cellular respiration and energy production. This system works in close collaboration with the cardiovascular system, ensuring oxygen is delivered to every cell and carbon dioxide is removed efficiently. Understanding the anatomical structures, physiological processes, and clinical applications of the respiratory system is essential for healthcare providers, public health workers, emergency responders, and life science professionals. This module offers a thorough, in-depth, and standards-based exploration of the respiratory system, integrating theoretical anatomy with clinical examples and diagnostics. Learning objectives. By the end of this module, you should be able to describe the gross and microscopic anatomy of the respiratory system, explain the mechanics of breathing and gas exchange, identify the role of respiratory muscles and pressure gradients, analyze common respiratory diseases and interventions, correlate respiratory anatomy to clinical assessments like spirometry, pulse oximetry, ABG, and radiography. Apply knowledge in line with international and regional professional standards. Section 1. Anatomy of the respiratory system. First, upper respiratory tract structure description and function. Nose, choch, nasal, cavity, warms, moistens and filters air, lined with cilia and mucus. Pharynx, shared path for air. Respiratory and food, digestive, nasopharynx air passage. Contains pharyngeal tonsils, oropharynx common passageway for food and air, laryngopharynx opens into larynx and esophagus. Lower respiratory tract. For structure and description and function will be used in our table. 1. Larynx, voice box, contains vocal cords, routes air to trachea. 2. Trachea, windpipe tube supported by C-shaped cartilage rings. 3. Bronchi right and left primary bronchi enter lungs. 4. Bronchioles, smaller branches, no cartilage, smooth muscle. 5. Alveolar ducts and sacs, terminal ends, sites of gas exchange. 6. Alveoli, 300 million per lung, surrounded by capillaries. 3. Lungs right. Lung, 3 lobes, superior, middle, inferior. Left lung, 2 lobes, superior, inferior, plus cardiac notch. Covered by pleura, parietal pleura, lines thoracic wall. Visceral pleura, covers lungs. Pleural cavity contains lubricating fluid to reduce friction. Section 2. Physiology of respiration. 1. Pulmonary ventilation. Ventilation equals the mechanical movement of air in and out of the lungs. Inhalation, inspiration, diaphragm contracts, flattens. External intercostals elevate ribs. Thoracic volume up, pressure down, arrow air enters. Exhalation, expiration, diaphragm relaxes, ribs descend. Volume down, pressure up, arrow air exits, can be passive or active during exercise or disease too. Lung volumes and capacities, volume capacity description, average value, tidal volume, TV, air in, out per normal breath, are 500 milliliters, inspiratory reserve volume, IRV, max air inhaled beyond TV, some 3,000 milliliters, expiratory reserve volume, ERV, max air exhaled beyond TV approximately 1,200 milliliters, residual volume, RV, air left after full expiration, 1,200 milliliters, vital capacity, VC, TV plus IRV plus ERV, 4,800 milliliters, total lung capacity, TLC, VC plus RV, 6,000 milliliters 3. Gas exchange occurs in alveoli via diffusion. Oxygen from alveoli arrow, capillary blood CO2 from capillaries arrow, alveolar air key principles, partial pressure gradients, O2 diffuses from high to low, surface area of alveoli, thin respiratory membrane, good perfusion 4, transport of gases, gas. Transported as oxygen, O2, 98.5% bound to hemoglobin, 1.5% in plasma carbon dioxide, CO2, 70% as bicarbonate, 20% bound to Hb, 10% dissolved 5. Regulation of respiration control center, location function, medullary centers, medulla oblongata, basic rhythm, pneumotaxic center, pons inhibits inspiration, chemoreceptors, aortic body, carotid body, medulla, detect, CO2, pH, O2 changes. Section 3, clinical relevance and pathology. Common respiratory disorders condition, cause symptoms, asthma, bronchial inflammation, constriction, wheezing, dyspnea, COPD, emphysema, plus chronic bronchitis, chronic cough, breathlessness, pneumonia, bacterial/viral infection, cough, fever, chest pain, tuberculosis, TB, Mycobacterium tuberculosis, night sweats, weight loss, pulmonary embolism, clot in lung vessels, sudden breathlessness, lung cancer, smoking, toxins, persistent cough, hemoptysis, pneumothorax air in pleural space, collapsed lung ARDS, inflammatory fluid buildup in alveoli, respiratory failure diagnostics, chest X-ray/CT scan, pulmonary function tests, PFTS, arterial blood gas, ABG, analysis, pulse oximetry, SpO2, sputum culture and microscopy, pharmacological agents, drug class examples, purpose bronchodilators, salbutamol, ipratropium, open airways, steroids, prednisolone, budesonide reduce inflammation, antibiotics, azithromycin, ceftriaxone treat infections, antituberculous, isoniazid, rifampicin treat, TB mucolytics, carbocystane, thin mucus oxygen therapy, nasal cannula, masks treat hypoxia, integrated learning and global alignment. This module complies with standard/agency key competencies covered, NCLEX, RN, US lung anatomy, gas exchange, acid-base balance, respiratory meds, NMC UK assessment, interventions, legal scope in respiratory care, WHO, global competency framework, public health, lung infections, e.g. TB, CO, VID-19, ventilation Africa, CDC/Nigeria, NMC/Ghana, RCN primary, respiratory assessment, education, diagnosis, triage, CPD and CME recognition, global meets CEU standards for nurses, physicians, respiratory therapists, instructional activities, label a lung anatomy diagram, measure respiratory rate and interpret findings, interpret a pulse oximeter and ABG result group work, asthma case study care plan, watch a lung inflation/deflation animation, disorders of the endocrine system, condition, cause and symptoms/impact will be used in a table. 1. Diabetes mellitus, type 1/2, insulin deficiency/resistance. 2. Hyperglycemia, fatigue, frequent urination. 3. Hypothyroidism, excess thyroid hormones, weight loss, tachycardia, anxiety. 4th, hypothyroidism, insufficient thyroid hormones, fatigue, weight gain, cold intolerance. 5th, Cushing's syndrome, excess cortisol, usually from tumor, obesity, moon face, hypertension. 6. Addison's disease, adrenal insufficiency, fatigue, low BP, darkened skin. 7. Gigantism, acromegaly, excess, GH, before after puberty, excessive growth. 8. Dwarfism, GH deficiency during childhood, short stature. PCOS, polycystic ovary syndrome, hormonal imbalance in females, irregular periods, hirsutism, infertility. Endocrine system and homeostasis. Interacts closely with nervous system, e.g. adrenal medulla, reproductive system, e.g. sex hormones, digestive system, e.g. insulin, gastrin, maintains balance in glucose, sodium and potassium, calcium, water balance. Clinical testing and diagnosis. Blood tests, e.g. TSH, cortisol, insulin, urine tests, e.g. catecholamines, imaging, CT/MRI of endocrine glands, stimulation/suppression tests, ACTH stimulation, glucose tolerance test. Pharmacological interventions. Condition drug therapy, diabetes insulin, metformin hypothyroidism, levothyroxine, hypothyroidism, methimazole, adrenal disorders, corticosteroids, fludrocortisone, fertility issues, hormone replacement therapy, learning outcomes, Bloom aligned. Bloom level learning outcome. Remember list the major endocrine glands and their hormones. Understand, explain negative and positive feedback mechanisms. Apply, interpret hormonal imbalances in patient case studies. Analyze, compare symptoms of hypo versus hypothyroidism. Evaluate. Assess hormonal therapy plans in endocrine disorders. Create, design a hormonal pathway. Diagram for stress response. Accreditation, mapping. Accreditation, body framework. Alignment, WHO. Health Science Curriculum Framework, NCLEX, US, NMC, UK, CAN-NCLEX, Canada. Allied Health and Paramedic Diploma, certificate level, BSc. Anatomy, Physiology, Public Health Standards, check, mark, CPD/CEU. Recognition check, mark, Europe, US, Africa, check, mark. Instructional activities, hormone role play. Act as glands, secreting specific hormones. Case study analysis. Diagnose hormonal conditions based on symptoms. Endocrine crossword and flashcards. Lab simulation, blood glucose regulation using digital platforms.